mostly because of its hospital size and its availability to have high and low acuity patients, and still being a center where we have 24-hour neuro-IR, 24-hour STEMI.
We have trauma patients that are coming to us from all different surrounding areas. We have a robust cardiac program. We get referrals for complex cardiac procedures, which we perform here.
Being a referral center, the residents do get patients from other hospitals that they don't feel like capable of taking care of. We have a lot more specialists available, and some of the other specialties that smaller community-based hospitals may not have on a daily basis.
Bayonet Point has started a culture. Everyone's here for each other. It's a team environment, starting with the residents and faculty all the way up to the teaching attendings. Everyone's here for each other. Everyone's accessible. The location we have is actually a pretty good blend of both city life as well as suburban areas. So we have access to the water, very close. You can drive into the city. It's very manageable.
We're also Tampa, so we're near to a big city, so we have access to the beaches and the big city environment, sports teams and everything else. At the same token, we also the smaller communities.
One of the nice things about being in this area is being able to have the short drive to hiking, camping, fishing, and that gives us an opportunity to really be able to decompress.
So Bayonet Point has a couple advantages over most programs. We have a wide variety of pathology, being a referral center, so we do get some of the bread and butter medicine, but then you see some of the interesting cases that you may not see at smaller hospitals. And then also being a community-based hospital to begin with, there's not as much silo between all the different programs, so internal medicine kind of does take care of all the patients.
Coming here, I knew I wanted to do cardiology. From the moment I got here, I was able to do a lot of different procedures, cardiac catheterizations, TAVR program, MitraClip, PFO closures, there's dedicated EP labs, and all of this is regularly happening, so you get a very good exposure to the wide variety of cardiology.
Bayonet Point is a great facility for internal medicine because of its large volume number of patients that we see with our hospital service, also the availability of having large numbers of hospitalist groups so that we can work close-knit with our attendings and receive good appropriate autonomy with also supervision and be able to learn throughout the 3 years that we're here.
Being a part of a network like HCA allows them to gain access to metrics and learning about the metrics and community-based physicians and how they practice, and can also allow them to in the future develop better employment opportunities as well.
We have classrooms here, we have computers for testing here and for studying and for research. We have sleep rooms, and this is aside from the space we have for residents in the hospital. It's a space we try to keep very private for them.
Bayonet Point is a fantastic option in the fact that we have multiple fellowship programs, so we get the experience of learning from specialists in cardiology, endocrinology, rheumatology, gastroenterology, and we also have a really large class, and that also helps residency relationships and helps with the process of being a team and a unit as we go through 3 years that can be very challenging but rewarding at the end.
I think they're going to see things and learn things here that they're not going to see at other hospitals. That's because we're a referral center. We get patients that fly in here for stroke, for trauma, and for complicated cardiac procedures. And I think that experience is what sells individuals on wanting to do their training here.